Hello, hello, everyone. I was just saying I haven't been by myself in a while. This feels. I feel alone. I feel isolated. No, I'm just kidding. I am missing Liz right now, of course. My good friend, Dr. Liz McInvale, is my co-host. We do the Ask the Experts every first and third Wednesday of the month together. So I'm so used to doing it with her, but she is taking a much needed break. So props to her for her self-care. So I'm kind of hanging in here solo today. So I'm excited to be with everyone out there. I don't feel alone because I feel like I'm hanging out with all of you, even though you're not like physically in my house, which kind of would be creepy if you were. I guess not actually. I have some food. We could chill. But anyways, yeah, I'm just excited to be here for this edition of Ask the Experts. So if you're new to Ask the Experts, I mean, what Ask the Experts really is about is we had so many people when we were doing live streams in the past ask tons of questions and we never got to them. And we always felt bad and we always kept pushing the questions off. And we did a couple, Liz and I did a couple just Q&As and they did really well. And people just seemed to love to be able to submit their questions and get them answered. So we're like, what if we, turn that into a stream? And it's been doing really well. We love answering your questions. So absolutely, that's what we're here to do today. Also, what I love is seeing the community in the chat. Everybody seems to be helping each other out, giving everybody advice, supporting each other. So, please feel free to communicate with others. So to start off, announce where you're from. In the chat, whatever platform you're using. I know this is live on YouTube. This is live on Facebook, Twitch, I think Periscope, and LinkedIn. So whatever you're watching live on, go ahead and put in the chat where you're from, where you're watching from. It's going to be good to know where everybody's hanging out from. So also go ahead and ask questions. I mean, that's what it's really about. What's nice about this platform is I can go in a little bit more depth with questions. We definitely have some questions that were pre-submitted, so I'll make sure to get to those as well. So if you submitted a question and are watching for the answer, I'll definitely get to those. But while you're watching live, go ahead and throw any questions that you have in the chat. A couple general announcements to start is this is for educational purposes only, not intended to replace therapy. So although I'm going to be able to answer your question and give you direction, I always suggest you find a clinician that you can work with locally, that you can have sessions with, that can get your background, your history, and know what's going on. So for treatment-related questions, please contact your local clinician. You can always use the IOCDF's online resource directory at iocdf.org/find-help. And there you can locate a trained clinician near you. It's a super easy service. You just put in your zip code and that goes ahead and you can find someone in your area. Also remember that the IOCDF is not a crisis hotline. So if you are in a crisis or you are ever feeling suicidal or unsafe, please go to your local emergency room or you can call 911 or the suicide prevention hotline at 800-273-8255. Also, we want to create as safe of a space as possible, so please be kind and respectful to everyone. This is being broadcast on several social media platforms, is being recorded, so please be mindful of this when you ask questions or leave comments. At the end of the day, we are all here to support each other. A couple things I want to announce that I'm really excited about is we have a couple different conferences coming up. So I'm Vice President of OCD Southern California. We are one of the official affiliates of the International OCD Foundation, and we're having our 6th annual virtual conference coming up Saturday, April 30th from 9 a.m. to 6 p.m. Pacific Standard Time. Even though it's from OCD SoCal, it's virtual this year, so anybody from anywhere can join. We have low-cost tickets. We also have free scholarships, so please go to OCDSoCal.org and you'll get all the information there. Also coming up, we just opened registration for the IOCDF Faith and OCD Conference. That's happening May 9th. It's for faith members, faith leaders, mental health professionals, anybody who would like to attend. So that's at iocdf.org/faith conference. A couple other things is the IOCDF conferences, the big conferences are coming up. We have the in-person conference in Denver in July, and we have the virtual conference. I believe this year it's in November after OCD Awareness Week. So make sure to go to iocdf.org. I think it's /conferences, and you can find out all that information. So there's a lot of good resources. And, I tell everybody, you go to a conference, you see some of the top speakers on the planet, you meet community members, you go to support groups. I mean, there's so much for you to do and for you to get out of these conferences. because they were life-changing for me. I know they've been life-changing for all the other members of the streams. Always remember, this is one of many live streams. You can always get the entire live stream schedule, and you can also submit questions and topics. We get so many questions and topics submitted, so we love that. That's at iocdf.org/peace of mind. You can also watch these live or view these recordings on IOCDF's YouTube, Facebook, LinkedIn pages, as well as iocdf.org/live. So that's really, really awesome. Make sure that you come next week. We have National Advocate Ethan Smith for Community Conversations. And then Liz and myself, we're going to do a brand new Lunch and Learn, and that's going to be based on ERP and justice-based treatment. So if you want to submit questions ahead of time, once again, that's iocf.org/peace of mind. And that will be next Wednesday. So a lot of exciting things going on. Once again, I am seeing people from all over the place. So we got Chico, California, Angela. I've been there before. I love me some Chico. What's up, Dave? It's good to see you. I'm always jealous of Nikki in Dublin, Ireland. I want to get out there so bad. Oh my God, Kostas from Greece. I'm half Greek. My mom's maiden name is Kalamiris. So my family cooks some good Greek food. They're finally teaching me. So shout outs from Greece. I was supposed to go in 2020. We know what happened, but I'll definitely be out there. I'm hoping next year. We got Brazil, which is a place I really want to go. I think SC stands for South Carolina. So this is awesome. Well, I'm going to jump in the pre-submitted questions. So please remember, this live stream is all about you. I would love to hear the questions or the things you're struggling with or some of your thoughts. So a question I'll kind of submit in the chat while I'm reading some of the submitted questions. What is the hardest thing about having OCD? Like when you wake up each day and you're dealing with OCD, like what's the hardest part about it? And let's say you had a platform. Let's say you could go on, a news station and it was broadcast throughout the world. What do you wish people would know about OCD and how hard it is? What do you think people don't get? So I'd love to hear some of your comments. So what are you struggling with the most when it comes to OCD? Like what's the hardest part about it? And what do you wish everybody knew? All right, I'm going to jump into the first question. So how can you have support when not everyone in your support network knows how to interact with someone going through serious OCD? So basically what this question is asking is, when you have obviously a support network, and your friends, they could be family, they could be different people, and they don't understand how to react to somebody with OCD. So I have a couple thoughts on this. My first thought is, when you look at your support system, kind of look at what role each person can play. I know in my own treatment, so for those of you that don't know, my name is Chris Tronson. I'm a therapist out here in Orange County, California, but I also have OCD and went through a really severe bout of OCD and got treatment. And what I realized is different people are going to be able to help with different things. So what I mean by that is I had some family that got OCD, and when we would talk about OCD, they'd really help me kind of coach through and get me to understand, like, this is what's going on, and really push me to do the treatment. And that was awesome. That was great. I was so happy about that. And they were a really good support that understood OCD. But then I had family and friends that just didn't know how to help. Either they would keep giving reassurance, even though I'd talk to them about what reassurance was and that they shouldn't do it. Or they would get very frustrated with me, or they just wouldn't know what to do. And so one of the things that I did is I started to stop kind of wasting my energy on individuals that didn't know how to support. And I had them kind of give me support in different ways. So maybe they were the kind of people that could come over and make me laugh, or we could hang out, or we could talk about, I don't know, like movies, or we could see, go to a theater together or something, just to get my mind off of OCD. So I recognized, like, who in my support system could step up and really help me with, when I was going through like serious bouts of OCD, and who was there to just make me laugh and have a good time. Like one of my sisters, she was always just so loving and supporting and didn't know what to do with OCD. She was young, but she always made me forget that I was struggling, and we would have a good time together and laugh. So that's the first thing I'd say, is maybe you can kind of reach out to people and not expect them to get it, but they can support you in a different way. The other thing that I would say is there are so many great resources. So the IOCDF has a lot of good resources, different books, different websites, different YouTube videos on their YouTube channel, iocdf.org. Or no, it'd be on YouTube. OCD.com/IOCF. But there's a lot of videos and stuff directly for family members and loved ones. At the conference, there's talks for family members and loved ones. I run a free family and loved ones support group every second Saturday of the month. So if anybody's ever interested, you can email us at info@ocdsocal.org, and we can give you the information for that. But we have about 70 to 90 families come each month, and that's resources for family members. So sometimes they just don't have the right education. So what you can do is you can provide them with resources in the media that they like it. If they like support groups, go to that. If they like podcasts, there's podcasts you could send. There's OCD Stories by Stuart Ralph. There's the OCD Whisper with Christina Orlova. There's Your Anxiety Toolkit from Kimberly Quinlan. So there's a bunch of really good podcasts. If they like YouTube videos, they could go to the IOCF's YouTube channel. If they like articles, they could go to the IOCF.org website and look at articles. So sometimes providing them with resources that are the most important way that they get their information, and they might turn into somebody who's an ally. So hopefully that helps. But the biggest thing that helped me was just not expecting certain people to step up and help if they just didn't get it, if they're just not the kind of person that would ever get it. All right, so I'm going to take my first live question, which is at 12:08 your time, Skyla. It is Kostas from Greece. My problem is hyper-awareness, and my mind constantly counts the people in the room to keep tabs on how many people are present. Is ERP just acceptance? The way that I like to think about ERP sometimes is like, if the OCD has you do something active, you're going to want to do something more passive in response, and vice versa. If OCD has you do something more passive, like avoidance, leave places early, then your behavioral component of the treatment is to do something more active. So for instance, like if you're finding Kostas, you get so agitated that you leave places early, that's a very passive technique. You're leaving early, you're not going places because it causes you stress, so you just kind of stay at home alone. Your treatment would then be to go places where people are going to be, and being in rooms where there's amounts of people. That would be your active kind of part of treatment. And the vice versa component, when your brain is constantly counting and you're fixated on that, your treatment is going to be more passive. So what we would do in this situation, if you were a client of mine and you're coming in and you're saying, look, like if I go to the store and I'm in a shoe store and there's 11 people there, my brain is constantly counting 11, focusing on them. You can't stop that right now. The good news is, like, when you get in a good place in treatment, like myself, like Ethan, like Liz, you get to a point where it's a lot easier to dismiss stuff. But when you're still struggling, that is not the treatment. The treatment is not to try to stop counting, because the more you try to stop counting, the more OCD is going to count. It's going to be a big like conflict and a mess. What you want to do is you want to take out your active role in the counting and really focus and channel your energy to what's most important in that room. So if I'm going to my example, if you go into a shoe store, I'm thinking of a shoe store at a mall nearby, 11 people, it's not a big shoe store. I'm going to tell myself, what am I here to do? Okay, I'm here to walk in, try on shoes, buy shoes, and leave. That's going to be my role. That's what I'm going to do. Unfortunately, I have OCD, and OCD is going to be counting in my head and pay attention, scan, and look. I'm not going to do what OCD is asking. I do have control of that. I can choose where to channel my energy, and I'm going to channel my energy into the shopping, into interacting with the worker, into trying on shoes, looking at shoes in the mirror, buying shoes, and leaving. That's what I can control. I can't control OCD counting, but I can control if I scan or not. I don't have to do that. Now, the thing that OCD is trying to do here, and what it does with hyper-awareness, is it tries to get you frustrated and agitated that it's occurring. So OCD is like, haha, Kostas, you have to count, and you have to hear me count. If you get agitated, if you get worked up and you get frustrated by that, sure, OCD's got you. So if you go in there and you're scanning and you're actively counting and you're looking and you're keeping track and you're not really paying attention and you're getting agitated, sure, OCD's got you, you're stuck. If instead you walk in there, you look at the worker, you buy your shoes, and you leave, and when OCD's counting, you're like, cool, there's 11, 12, I don't know, not really my thing, don't choose to actively do it. And then OCD's like, yeah, but aren't you annoyed? Yeah, sure, it's annoying, but I have OCD. I'm kind of used to it at this point. And then OCD's like, yeah, but you're going to count forever and be stressed and break down, and you're never going to stop obsessing. You're never going to stop ruminating. You're never going to stop being triggered. Okay. Just like somebody that's lost a limb has to walk around without a limb, they learn how to function. I'll learn how to function with this. OCD can't get under your skin if you don't let it. So I hope that gave you enough detail, but that's what I would have you do as an exposure. I'd have you go into a room, be present and mindful for what the purpose is that you're there. And when OCD is asking you to scan and stuff, you don't have to, don't do it. And then when it tells you that it's agitating and it's never going to stop, own it. Sure. Okay, fine. I'll have to learn to live with it, like people learn to live with high cholesterol or diabetes. I guess I'll just have to live with that. So hopefully that's helpful. Hopefully I didn't miss anything. Yvonne at 9:08, 12:08 your time, washing hands and not wanting to touch anything. So you answered my question. What's the hardest part about having OCD? So yes, I get it. I was a hand washer. My hands used to be so red. I even have a picture. When I was speaking at a conference once, I showed the picture, but my hands were red, and everywhere I go, people would ask. And I used to tell people I was a boxer, which in retrospect was a stupid thing, but I just was so embarrassed. And I was like, yeah, I'm punching things all the time. What's so hard with washing your hands is you wash your hands, and there's something about the soap and the water and the movement and the focus on your hands that kind of resets you and makes you feel calm. And then it's like, yeah, you want to kind of hold your hands up here and not touch anything, because as soon as you touch something, you feel compelled to wash your hands again. And it's exhausting and it's time consuming. And then you wash your hands and you feel that clean again in that baseline. And you're like, ah, it feels so good. What helped me, Yvonne, obviously, is just reduction. I started creating a threshold. Like, I'm going to wash my hands when I hit this point. I'm not going to wash my hands any sooner than that. So it's really difficult, because obviously you don't, it's easier said than done. But I started telling myself, like, okay, I'm not going to wash my hands just because I bump into the back of something. I didn't touch the front, or, I'm only going to let myself wash my hands 10 times this hour. Or some kind of reduction would help if you feel like just eliminating it altogether is too difficult. Gentile at 12:11. Hello, hello. You said the hardest part of OCD is that I can't talk to my friends who don't live near me to get emotional support because of the compulsions. I wish people would know that it's not simple to not do compulsions. Great point. I actually was lucky enough to be interviewed yesterday for an article, and they were talking about intrusive thoughts. And I don't know if everybody can relate to this in the chat, but I was trying to explain to them, it's not just having intrusive thoughts. It's much more than that. It's an experience. Like, when you have intrusive thoughts, your whole body reacts. Like, anything else that used to matter goes away, and you're fixated on that. And then your heart rate is racing. Your heartbeat is racing. Your focus is on that thing. Your body is shaking. Like, you have so much adrenaline. You're getting vivid images. You're having the thoughts. And then your brain is like expecting you to do these compulsions so that you can reset and be calm. And when you're not doing it, your brain just gets louder, and the OCD yells at you and gets louder. Come on, come on, come on. So I always tell people, the reason you can't just stop compulsions, it's like asking somebody to cross the street and a car is coming and going to hit them. And you're like, don't do anything. Just stand there, get hit. You're like, no, I'd never do that. So totally, totally difficult. Gentile, one thing I will say that was really helpful for me is to start doing proactive exposure. So what I mean by that is I stopped waiting for OCD to throw something at me and then trying to react the treatment way. I would deliberately put myself in a situation that I could handle. And then that way, when OCD asked me to do a compulsion, it was a lot easier to fight it because I chose to be here. So an example was, I didn't like to go to a beach nearby because there was a power plant nearby. And so in my head, it was like expelling contamination and radioactivity and other stuff in the water. So if I was going to swim in the water, I was going to get cancer, some kind of health issue. So I remember the first exposure I did was I literally just drove and parked in the parking lot, which was really hard for me. And I kept the windows open and the vents closed. But even just being there, I felt like it was dangerous. But because I chose to go there, it was like not as difficult. Whereas if I was with a friend, actually at the time I was housebound, so I wasn't really with friends. But let's say for some reason somebody would have driven me to the beach without giving me a heads up, I would have had a panic attack. So that's something to remember. If you can willingly do the exposure, it's going to be a lot better. Rachel's from the UK. We'd love to say hi to all of the people from all over the area, the world. ERP, thank you, IOCDS. So remember, it's exposure and response prevention. It's a type of cognitive behavioral therapy and found to be the gold standard treatment for OCD. And some people do combine it with medication. All right, so we have Grover from LinkedIn. And so how can you have support in the workplace? So I'd always say first and foremost, you know, if the support you're looking for is like support from coworkers, I'll start there. Always remember, I mean, I would just make sure you trust that coworker, that you could open up to them. So if you have a coworker that you've noticed they're kind of dealing with stress or anxiety or depression or maybe even OCD themselves, they're probably an ally in the workplace, and you could go to them and absolutely have a talk and a conversation with them and open up if you're comfortable. And remember, you don't have to open up and share. I dealt with checking and contamination, but I also dealt with harm and sexual intrusive thoughts. And I didn't open up about those to people because I knew they wouldn't understand it. So I opened up about some of the OCD that I knew they did. And so that's what I would say first and foremost is you can open up as much or as little as you want and to who you want, kind of pick the people that are allies. The other thing, like I was answering the question that was submitted earlier, decide what support looks like for you. If for you, it's like, I just want coworkers to go out to lunch with me so I can get out of the office where my compulsions are and just de stress, awesome, do that. If it's more like somebody who understands OCD, it's asking that person to go to a support group with you or to, read an article. If it's more so support when it comes to functioning in the workplace, the good thing, I don't know where you're from, but in the United States, we have something called the ADA, the Americans with Disability Act, and it protects us with mental health conditions. So when I got my first job at LA Fitness, I had to switch medications, and it made me extremely tired. And I was sleeping in my car on my breaks. And for some reason, I had a boss that just was not okay with that. And so she ended up firing me. And it didn't make sense because it was my breaks. I wasn't supposed to be on the clock. And I just had to sleep in my car to get, energy back because the medication was making me tired. She fired me. And I went to HR, talked about the ADA. I got my job back. She actually got moved to a different section. So I didn't have to work with her, thank goodness. But my point is we have protections here in the United States. I don't know other countries. So you can always go to HR. You can go to your therapist or your psychologist or psychiatrist or doctor. And there may be some accommodations that they can do. And what I always tell people is like, make some accommodations with your therapist and then go to your work. And then make it a step down plan. So, if you're having a really hard time getting to work on time because of compulsions, create a treatment plan with your therapist and really focus on that first. And then that way, you tell your job, like, look, because of medical reasons, I'm struggling to get here in the morning. I need a little bit of flexibility, but I'm working on this with a doctor. And, we have this treatment strategy to over the next 2 to 3 months to really work on this so I could be back in time. I just need those accommodations temporarily. So there's all the time, there's different things in the United States that people, if they need time off, for instance, there's leave of absence that you can get. Usually you need a doctor, therapist, psychologist and stuff to write that, but that's how you can get support. And if you have a manager or a boss that's really understanding, talk to them. Once again, you don't have to open up about everything, but just talk to them about what you're going through and seeing if they'd be willing to help in any way. Hi, Ken in the Philippines. Salamat po. I know a little bit of Tagalog because I have some family members that are Filipino and some friends. So kumusta? My kababayan. So jealous that you're out there in the beautiful, beautiful Philippines. Exactly. I see Leanne made a comment. What you focus on becomes larger. Absolutely. So when we go back to that comment about counting the people in the room, that's exactly right. The more that you focus on how many people are in the room, or the more you focus actively on how stressed you are about having to be counting all the time, absolutely. I mean, that's the thing that you're going to notice is that the more you focus on it, the larger it becomes. And you had another question, Leanne, at 12:15 about scanning. Can you tell what scanning is? So something with OCD, a lot of people do is scan. So an example for me is I had a fear of getting cancer. And so I thought I was going to get secondhand smoke from smoking. And obviously you can. But for me, it was like somebody could be smoking outdoors a mile away. So when I would walk, I would constantly scan and just make sure I didn't see anybody smoking, or I'd sniff for it, or I didn't like to step on things that were contaminated because I didn't want my shoes to get dirty and then drive and get it on there. And so for me, I would constantly scan and look at the floor when I was walking. So somebody who's counting all the people in the room, they're going to walk in that room and actively scan and start to count. So what we notice is that when we scan, the thing is, remember with OCD, we're trying not to cause conflict in our brain. So if we're scanning, it's because we're actively looking for a problem and then freaking out. I mean, one thing, going back to the comment about actively counting people in the room, the other thing that you could do if it's effective is walk in and purposely count, kind of take over OCD's job. Because if you're resisting counting, you could walk in the room and purposely count and be like, cool, there's 11 people. Great. Now I'm going to go and move on to what I have to do. If OCD's like, yeah, but people are leaving, make sure you count. And I'll count if I want a little bit later, but I'm busy right now. So scanning is just, a lot of people do it. They're looking out for danger. And so what I try to work with clients instead is be mindful, be present. If you're going to a restaurant, walk in, see your friend, sit down and talk to them versus scanning for a potential trigger. Yes, Felice, I would say one of the most difficult things about having OCD, you're absolutely correct, is being adaptable, because OCD is very black or white. And I would say that's one of the hardest components of having OCD, because everybody else lives in this world of gray with flexibility. And because, because of not having any kind of flexibility, what it does is it prevents you from being able to adapt or be flexible. And so an example is like, if you have plans that day and somebody cancels plans, the average person would be like, oh, cool, no worries, I got it, I'll make other plans, I have other things to do. Somebody with OCD instead, it's like, if their plans were canceled, they might just sit and kind of scan on their phone for hours, because they're just like, I don't know what to do, I had plans, they got canceled, like I can't even focus, like that's what I was supposed to do today, and they get so fixated on it. So part of your treatment is to learn how to live in that gray. Imagine what would be black and what would be white. So if, like, you're with cleaning, let's say cleaning your house, if white was cleaning your whole house with bleach from top to bottom, and black was just kind of like letting it be dirty and just letting it fall apart, what would be a balance? Okay, I'm going to clean, but maybe I'll only clean a room for a day, or I'll clean a little bit, or something like that. So it's being flexible. So absolutely. Gentle has another question that says, is it normal for symptoms to get worse when I'm very happy or very sad? Yes. I mean, OCD deals with emotional dysregulation. And what the research shows, when I was doing my thesis years ago, the research showed that individuals with OCD have difficulty with emotional regulation. So we feel extreme highs and extreme lows. And so what I notice is, like, when people are really, really sad or really, really down, it's like they get intrusive thoughts, and you have less energy to kind of fight them. You sort of just give in, you give up. When people are really happy and excited, whenever you're kind of feeling extreme motions, like, it's not abnormal to have a lot of symptoms. If you're sick, if you haven't eaten, if you're tired. So obviously you can't be perfect all the time and be in like good mood and like sleep well and eat well. So part of the treatment is learning how to kind of preemptively expect an onslaught of symptoms. If you're noticing that, an onslaught of symptoms, if you're noticing that you're sick or tired or happy or sad or something like that. I think sometimes the reason it hits you when you're happy is OCD it wants to kind of destroy your happiness. So for me, if I was like happy and I was out with friends, OCD was like, nope, 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 something could go wrong, and would list all the bad things that could happen. So it is definitely normal. The best thing to do is just start to notice your triggers. What creates more intrusive thoughts, more obsessions, more unwanted images? Is it when you're tired? Is it if you don't work out? Is it if you're really sad? Is it when you're really stressed? And just kind of notice that and be curious about that, because eventually what will happen is, if that was to occur, you could get to a good place where you're like, oh, I'm ready for it. OCD is going to bring on a lot of intrusive thoughts. So I'm going to jump up and I'm going to write a script, a worry script, and read that, an imaginal exposure. I'm going to deliberately do an exposure. So kind of getting out in front of it before OCD has any time to, to do anything. So Costas and Gento, I'm glad that advice helped you. All right, Jessica at 1220. Hi, Chris. Any thoughts, strategy, advice on struggling with crippling OCD-related anxiety while having to study? Thanks, and please send love over to Moscow. I hope you're doing okay. Obviously, in the United States, we don't know everything going on over there in Europe, but it seems scary. So I hope you're safe and you're okay. And this feels so weird doing it alone. I feel like I'm talking a lot, but then I realize if I don't talk, it's awkwardly dead silent. So I have to talk. So hopefully you're not all annoyed by my voice. But Jessica, yeah. So, okay. I think what would have helped me a little bit is to know, is it OCD, like how the OCD is impacting studying. So what I'll do is I'll kind of just give you advice based on some of the typical things that I hear from people. So when people are studying for an exam, a lot of times they can't focus on the here and the now. And instead, their brain is fixating on like, you got to retain this information. It's got to be great. You got to read everything. You got to know everything. You got to study everything because you don't want to fail this exam. So OCD likes to take us out of the present and the here and now and have us kind of freak out about the future or ruminate about the past. And the problem is I can't do anything about my test tomorrow except study. So me ruminating, me getting fixated, me, having mental compulsions around potentially failing the test if I don't study well enough is actually deterring me from studying the one thing that can help me. So when we talk about accepting uncertainty, I know John Grayson and Liz McInville did a really great presentation on that over a couple weeks here on our live streams. What I'm asking myself to do is I'm saying, I don't know how the test is going to go tomorrow. It could go amazing. I could walk out there feeling confident. I could get the highest grade in the class. It could go bad. I could bomb it. I'll have to talk to the teacher. I'll have to see if there's extra credit. I might have a lower grade. It could go kind of mid. I do well enough that I keep my good grade, but it's not as great as other students. It could be somewhere on a range. I don't know. I can't do anything today about it. What I can do is study. So I'm going to study knowing that there's a potential that I could bomb or I do great, but that's tomorrow's problem. I'm going to let future Jessica handle that. But current Jessica can sit and study. And when my brain says, oh, but you could fail, I could fail. That is an option. I mean, that's not very likely I'm going to get a 0, but I could do poorly. But that's not what I'm working on right now. What I'm working on is studying. So I'm going to focus my attention on this. I'm going to retain the information. And I'm really going to focus on this because this is where my attention needs to be. I can't focus out there. If you have to reread, for instance, because that's a common one, people have to reread because they didn't think they got everything. What I tell people is take those little sticky notes, like those really small ones, and just put it on a couple random pages and say, look, I'm deliberately not going to read everything because I have these sticky notes covering little sections of the reading. So I'm going to have to read knowing that I'm not attaining 100% of the information. And we'll see what happens, but I'm not going to let myself lift up the sticky note because then I'm going to seek perfectionism, which is going to have me reread, and then I won't even get through the study material at all. But in conclusion, Jessica, what it's really about is, we associate anxiety with tests and with studying already, and it's your job to minimize how much you buy into that. Have confidence. I'm going to read the study material. I'm going to do my best. And look, the worst that's going to happen is I do poor on the exam and I'll have to do better on the other one. When you don't let OCD blackmail you, because OCD is going to blackmail you and tell you you'll fail and you'll drop out of school and you'll never get anywhere and you'll be homeless. I mean, sure, it could happen, right? But if you don't let OCD bully you about that and you're just like, you're right, OCD, you win, congratulations. Like you're taking that conflict out and you can get back to studying. If I didn't answer your specific question, go ahead and put in the chat more questions about studying. Hi, Veronica from Singapore. Fun fact, I used to want to go out to Singapore because somebody told me once it's one of the cleanest countries. And because of my contamination OCD, I was like, I want to move there. It looks so clean. I hear it's clean. So Veronica at 924 says that COVID pandemic has made things difficult. Absolutely. I would say it's made OCD difficult for a lot of different reasons. I would say the first reason is obviously if you have contamination. In the beginning, people were telling us to wipe down products and sanitize and wash hands. And so it almost validated and gave us, it almost validated and gave us permission to do the cleaning that we had been told by our therapist not to do. So it made it difficult to then pull back. OCD doesn't like to change courses. So we, for so long, did that. And then when we were told, hey, you don't have to do that, it's more respiratory, you don't have to be wiping things down and stuff, the OCD is like, let's be safe and keep doing it. But let's say you didn't have OCD around contamination stuff after COVID, but it was different reasons. The isolation, we know isolation is never good. A lot of people working from home. Now we're by ourselves in our house. We can do compulsions all day. At work, you had to kind of hold them in or in public. But when you're stuck inside, you can do compulsions all the time and nobody would ever notice. Isolation and depression, what a lot of people felt because of COVID, the isolation from the pandemic. mean, that's going to bring on more intrusive thoughts. It's going to bring on a lot more problems. So, yeah, I mean, absolutely, it brought it on. So my hope, I don't know where everybody's from. My hope is that your state or your country, the numbers are going down. It's starting to get safer. I know for me personally in California, we've been one of the more strict states with regulations. A lot of things feel normal now. And so, as much as I can, I've been going out and like engaging, still being safe, but I'm starting to feel normal again, which is great. So the problem is OCD doesn't just vanish because we want it to, but my hope is everybody's getting the help that they need. These live streams have been helpful, and you can kind of go back into some real life. Okay, Leanne says they don't do scanning, so that's great. Yeah, Costas, I mean, if there's only 2 or 3 people in the room, sure, there's automatically an answer. So like I said, what I would do is I'd walk in that room. I'd be like, great, there's 3 people. My brain is going to want to count how many people are in for the rest of the time I'm here. I don't have to choose to fixate on that. I can fixate on why I'm in that room. If you're in the room to, have a conversation with friends, let's say you go to a friend's house and there's 3 people in the room, focus on them, focus on the conversation, have a good time. When OCD is counting in your head, it's distracting, it's annoying, it's obnoxious. But once again, it's sort of like if you had a neighbor that plays loud music and you've already made complaints, and finally your complex is like, dude, they can have loud music on till 10. You either move or get over it. You get over it. You're like, all right, I'll figure it out. It is what it is. So we learn to live with the OCD versus trying to get rid of it. All right, so we have from YouTube at 12:30, we have Yu Ying Ren. It says, thank you so much for this live stream. You're suffering from harm OCD. You're constantly worried that I got run over by a car and not sure whether any damage or harm has happened. I'm wondering are you worried that you got ran over from a car? Or are you worried that you ran somebody over? So I'm going to answer this both ways. So in both, yeah, because it doesn't really matter. I mean, if the OCD is saying that you got hit by a car and you have damage and harm, my guess is the compulsion is going to be like scanning. Is my health okay? Do I have any health problems associated with getting hit by a car? Researching online, like what are typical issues that you have, with getting hit by a car, things like that. Or my guess is that if you hit somebody with your car, checking your car, seeing if there's any dents, any blood, driving back around the street, looking at the news that night to see if there's any reports of any injuries, driving by the location the next day to see if there's police. So in either of those, what it is the OCD doesn't like uncertainty. It's saying I can't be 100% sure if I caused harm or if I was harmed based on how this question was asked. And the mistake that we make with OCD is we think the more information we gather, the more clear we're going to be. Because let's face it, that's how it is in real life, right? Like if I'm trying to be an expert in a field, I'm going to study, I'm going to learn, I'm going to research. With OCD, it doesn't work like that. In fact, a really good government study that I read shows that individuals with OCD, the more that they try to figure things out and ruminate and check, the less confident they are in their initial thoughts, and they go down kind of a spiral and they become less and less sure and less confident. So that's almost like making a photocopy of a photocopy of a photocopy. By the 10th copy that way, it's blurry and it's dark. You can't read it. It's the same with our thoughts. So what's happening is if you are, let's say, going around the block to see if you hit anyone multiple times, or let's say you're going in the mirror to see if your clothes have been damaged, or checking your vitals to see if you've been hit by a car or ran over, you're going to be less confident. You would think, hey, after 10 drive arounds or asking 15 people if I look like I got hit by a car, you'd be even more sure. You're going to be less sure. You're going to walk away from that situation even more confused than when you started. So what the treatment is what we were talking about these last streams, is living with uncertainty. It's saying, you know what? I don't know if I hit somebody with my car, but I'm not going to check my car. I'm not going to check the news. I'm not going to drive by that location tomorrow. Or like I said, if the question is if you think you got ran over by a car, I'm not going to look in the mirror, not going to ask for reassurance, not going to try check my vitals, my health situation. Just going to move on. I'm going to live with that uncertainty. I'm going to choose to take a passive approach and not do anything extra and do anything, and just move on to what I have to do next. You would think that would be worse, but what's going to happen is your anxiety is going to subside because you're not actively giving into it. You're learning that you can handle stress, distress tolerance. And then pretty soon, once your anxiety is down and you're kind of clear headed, the answer comes to you. It's like, well, no. I mean, I would know if I was hit by a car, I'd be in the hospital, or I know if I hit somebody with my car, I would have learned it. But you're not going to get there the more actively you try to figure it out. So you have to take a more passive approach. I'm going to take a quick second to answer some of the pre-submitted questions. There's two questions that I would definitely be better answered by somebody who is a psychiatrist. I'm going to give an answer based on like clinical practice, lectures I've gone to, but I'm not going to get as in depth because I'm not a psychiatrist. But this makes me think that one of the guests that Liz and I should have on is a psychiatrist to answer your medication-related questions. So one of the questions is, why would a psychiatrist prescribe an antipsychotic for a patient that has OCD? So once again, I'm going to answer that at my level, and really, I'll talk to Liz about getting a psychiatrist on. Sometimes when people have really, really severe OCD and they don't have a lot of insight, like they really think at times like their intrusive thoughts are real, an antipsychotic can help with that clarity. It can help you have a better understanding with your thoughts and give clarity and a little bit more insight. Also, if people are having really severe depression, a lot of times an antipsychotic can really help with mood. So sometimes I think of them as a little bit stronger than an SSRI like Prozac or Luvox. So once again, that would be something you have to get prescribed from a medical professional that can prescribe. So in California, a therapist can't prescribe medication, whereas it needs to be like a nurse practitioner, a doctor, a psychiatrist. So I'd recommend that, and especially recommending somebody that works with OCD, particular, so that they understand it. The second question is, other than ERP and SNRIs, there are recent alternative psychiatric treatments that have been shown to exclusively help reduce symptoms. Is there, like ketamine, CBD, medical marijuana, psilocybin? They seem to be in the news. The only reason I know a lot about this is because I just did a presentation with a psychiatrist on this topic, and they took the lead. What they said is that ketamine has been shown to help with depression, but not always long lasting. Psilocybin, which is found in like mushrooms, which is a psychedelic, they're using like a really low percentage, like a 5 to 10%, not, like the street amount. And they're having some like early stuff, but not necessarily on OCD. CBD, my clients have said, helps them like physical pain, but not as much with OCD. And then there's a really good article, I think it was from Patrick McGrath and another doctor or another therapist on marijuana and its effects. That was actually in the IOCDF newsletter. I believe it was in 2010. So maybe if you are a member of the IOCDF, you could go back to that. What I remember from the reports is like some people it helps, some people it makes worse. I think it all depends. But like I said, that's going to be something that I really think that Liz and I need to get a psychiatrist who could delve in deeper. And that's what I would always recommend when it comes to medication is please, please, please make sure that you find somebody that understands medication for OCD, the latest research. Us therapists can kind of help support you, but you really should find a psychiatrist. So I will note those questions for when Liz gets back, because I think those will be really, really helpful. We'll find someone. Absolutely. So Jessica, you added, it's making you do things more slowly. So with studying, so it's impacting you the amount of symptoms from your, what's impacting you is the amount of symptoms from your sexual orientation OCD. So that's why you're, it sounds like you're studying slowly because you're distracted from that. What I would say is that with, that was at 12:31. So when we have intrusive thoughts around sexual orientation OCD, remember, we don't want to mistake those for obsessions. The obsession is what comes up. So let's say you're studying, it's 8 o'clock, and you get an intrusive thought about sexual orientation OCD. What happens is anything you do after with that thought is the compulsion. So if you're if you're sitting down to study and you're getting intrusive thoughts about sexual orientation OCD and you can't focus because of that, what it tells me is that you're putting a lot of attention on the intrusive thought. And it's because my guess is you don't want to accept the fact that you could potentially be attracted to women. So what happens is OCD says, I know studying is important, but put it aside. We got to figure out your sexual orientation. You have to know you're 100% heterosexual. You have to feel awesome about it. And then you can get to studying. It's a trap. It's a trap. It's OCD. It's never going to be like a sit down 5-minute conversation. You get clarity. The more you try to figure it out, the more convoluted it becomes, the more confused you are. If you do get a great aha moment, 20 minutes later, you're going to be triggered by something else and be back in that loop. So we want to ask ourselves, okay, like I could be. I mean, I maybe I see a baby in the picture. Maybe you're dating or married to a man or engaged and you have a child. That's not good enough for OCD. It wants 100% certainty. We have to decide we're not going to give it to OCD anymore. We're not going to do it. We're not going to give it the search for certainty anymore. So it's like, look, I may potentially be part of the LGBTQ community. I may not. I don't know. But I'm not going to try to figure it out right now. I'm not going to take that active approach. I'm not going to actively, in my head, fixate on that fear and spend the next hour on it. I'm going to choose to shelf it and say, look, like I might have to figure this out later, but what's most important is studying. You want to direct your attention to the studying and really focus on it. And when your brain is trying to bring up sexual orientation, intrusive thoughts, it's like, thank you. Thank you for sharing. Great, fascinating about my sexual orientation. But I'm okay with not knowing right now. It's not something I'm going to actively search out. So thank you for sharing. Absolutely. And go back to studying. Is that simple? No. But an example of a proactive exposure you could take would be watching a TV show that maybe has two female queer characters. And then, watch that for 30 minutes, let the thoughts, the feelings come up, and then sit down to study and say, I'm going to focus my attention on studying. And I'm going to choose to not know my sexual orientation for the next 30 minutes while I study. And when OCD is like, but come on, Jessica, we got to know, we got to figure out. No, I'm not going to know. I'm going to study. That's what I'm going to choose to do. It's a science. It's an art. It's a muscle. As you start to do that, now where I'm at in my recovery is if I get an intrusive thought and I'm focusing on something, I don't even respond anymore. And it just passes on by. So I promise you can get there. Absolutely. Kira asks, is anyone at 12:38, is anyone's rumination OCD worse when they first wake up? Mine doesn't start to ease up until I really get my day started. Yeah, so some people report it's bad when they're sleeping, like right before bed. So they'll stay up all night till they get so tired they kind of like pass out so they don't have to deal with intrusive thoughts and rumination. And then other people will say, like you said, right when you wake up and it like hits you hard. Because the brain is like, all right, come on, you're up. Let's go. We had a whole night of no rumination. Let's go. And so what you want to kind of handle is an example of an exposure I give my clients is if the rumination hits about the same topic each morning, have a narrative or a script like written. You can even record it and like right when you wake up, play it and just practice like bringing on the thoughts yourself. And it's like, sorry, OCD, I beat you to the punch. And practice like listening to that imaginal script. Listen to it while you're eating breakfast. Listen to it while you're getting dressed. So it's always like you want to beat OCD to the game. We know OCD is going to give us intrusive thoughts. We're going to want to ruminate. That's going to happen every day. So if we kind of beat OCD to the punch, we almost take the job away from OCD. And then OCD is less powerful if we're deliberately choosing to do that. You could even like have a poster of something triggering. So when you first wake up, it's the first thing you see. We don't want to run from it and shy from it. We want to bring it on. So hopefully that helps. All right. So Kim Cashman, what a cool last name. Ooh, Chris Cashman. Sounds like I'd be like I was going to say an actor, but it's not really an actor name. That's more like Chris Cashman would be, I feel like selling cars. That's the first thing that came to my mind. Kim Cashman sounds cool, but Chris, it sounds a little hokey. So I take it back, but it's still a cool last name for you. Okay. Kim asks, we have a son with mental ritual OCD who has been through many programs. They all want him to track his compulsions, and he says it makes him worse. Any ideas for that? Okay, so it sounds like for him, his OCD is predominantly mental. I know some people call that pure O. It's like more mental obsessions, more mental compulsions. So what it sounds like is tracking his compulsions just makes him more attuned to them, more aware of them. And my guess is like, then what it's causing him to do is fixate on his mental compulsions and then writing them down. So it's turned into a compulsion. As clinicians, we have to adjust and we have to be flexible. So if somebody is doing compulsions, if part of the treatment becomes a compulsion, we got to change course. We got to do the opposite. So what I would work on if your son was working with me is what I'd say is, okay, if tracking your compulsions makes you fixate on them, scan for them, find them and write them down, we don't need to track compulsions. What I want you to do instead is to not do the compulsions in the first place. So it's a little hard because I don't have exactly what he's going through. So I'll make up like a mental ritual. Let's say anytime he has a negative thought about hurting his sister, I have no clue if that's his OCD, he has to then think of like doing a good deed for his sister. So that's like a common compulsion people will do, is they'll have like a good thought to replace. And let's say the goal is to not have the good thought, but then it's like he has the good thought, he has to write it down, and then that whole sequence becomes the compulsion. What I would say to him is, I don't want you to track your compulsions. What I want you to do is spend time with your sister. I want you to hang around her. I want you to prioritize spending time with her. And then when the intrusive thought comes with hurting her, I want you to practice in the beginning, maybe delaying, but eventually eliminating, actively bringing in a positive thought to replace that. Instead, I want you to focus on that bad thought, let that bad thought sit there, allow it to be present, but engage with your sister. And so what I would do is, with treatment is just talk to them and say, look, like it's making it worse. Here's an example. Like I had a client who had harm OCD, and they had like the exposure was to keep knives around them. They kind of got over that fear, but then they were so fixated on, I have to have a knife around me at all times because I want my treatment to work and I want to get better. So I have to have a knife all around me. And so then they became fixated with constantly needing a knife around them to do the exposure to get better. And I'm like, you've already done good. Like, move on, go live your life. Like, you don't need knives around anymore. You're doing great. So sometimes people with OCD can make the treatment part of the compulsion. So as a clinician, I would just not have him track it. I would more so do active exposures with him in session so I could get my own gauge on how well he's doing. And then I would have him report overall, just how is he doing? Is he doing the ERP? Is he really good at letting those intrusive thoughts about his sister present? Bring him on himself. And then actively the response prevention is to not deliberately tune the world out, think of a good thought, replace it, and then feel good about it and move on. So hopefully that helps. Oh, good. So Marcia says that she's doing well many decades later because she decided to not do all or nothing. So yes, all or nothing is definitely not needed. Kira, I just want to make a quick comment. You said at 12:35 that you still wash your hands after opening a new package you bring home from the grocery store. What I've really worked on with my clients is we got to update our information. I agree that when the pandemic came out, we were doing that, people without OCD, but we've since learned that that's not how it's spreading. So what I want you to tell yourself is when you do that, you're not doing it for health reasons. You're not doing it to be safe. You're doing it strictly for OCD. So what I mean by that is as you're opening the package and washing your hands, tell yourself, I don't like to feel anxious. And so the OCD is going to make me feel anxious. So I'm washing my hands to make the anxiety go away, but I'm not washing my hands to keep myself safe. I will not let OCD lie to me anymore that this is about safety. It's about not wanting to feel discomfort. So sometimes that can help for sure. Okay, so yeah, so Yu Ying, you did say that it was about you getting hurt. So the advice that I'm glad I did both. So hopefully that advice helped. Jessica, you said you loved how to put it, the current Jessica, the future Jessica. Yes. So the reason I always say that is because what OCD does is it has us doubt our future self. It tells us that our future self will not be able to handle a problem and we have to handle it right now. But I trust future Chris. I trust that future Chris will be able to handle a situation in a week or a month, and that current Chris can focus on whatever he's doing and let future Chris handle it. A lot of times OCD is like, no, future Jessica can't handle it. You've got to do the compulsion now. Don't listen. It's a lie. I always want to say that. OCD is a liar. All right, so Chub Hub at 12:45 from YouTube says, how do you deal with a bad feeling after the uncontrollable rumination? The feeling that I want to stop ruminating, but my mind just keeps spinning. So let's say I'm ruminating because Like, here's an example. So when I would go to an underground parking lot, you'd see those signs, at least in California, they're called Prop 65, and it would say spending too much time here could be unhelpful for your health. It could cause cancer. And so what they're really talking about is if you're in an underground parking lot all day, every day, you're inhaling fumes. It's not healthy for you. But if you park your car and leave, it's fine. OCD, of course, black or white, it's either going to give me cancer or it won't. So it would give me cancer. What I would find is after I'd park, the intrusive thought, you're getting cancer. That's what OCD's job was. Whatever I did after that was my job. So if I gave into the rumination, that was a compulsion. So if I would park in an underground parking lot, because there was a shopping center that I'd go to, if I spent the whole shopping center, am I going to get cancer? Okay, should I have hold my breath? Okay, how long did I sit in there? Okay, it says, not to do it continuously. How many times a week? Okay, when I get home, I need to Google and I need to research. All that is rumination. All of that is trying to fix and solve a problem. That's the compulsion. It's just like somebody washing their hands or driving around the block. It's the exact same thing. So what I had to start doing is saying, once I got out of the parking lot, it's like I chose to park in that parking lot. I'm going to walk in and out of the parking lot normal. So I'm not going to hold my breath. I'm not going to sprint in and out. And while I'm shopping, I'm going to focus on shopping. I may find out in the future that I get cancer, and it could absolutely been because I went in this underground parking lot. But at the end of the day, so do millions of people. It's part of our society. I've already given up too much to OCD. I'm going to park there and I'm going to go shopping. Now, OCD wouldn't leave me alone. It would follow me around in every store. It's like, okay, well, are you sure you should have parked there? And it's like, look, OCD, I may have given myself cancer, but the bottom line is there's nothing I could do about it now. I'm going to walk back into that parking lot after. I'm going to go to this parking lot a couple more times this week. It's done. There's nothing I can do. I'm choosing to do nothing about it. And I no longer need to ruminate because I'm accepting uncertainty and tolerating bad things happening. Good things could happen too. Okay, things could happen. So I'm done. There's nothing left I have to say. And think about it in real life. Like, argument can only happen if both sides are arguing. So I stopped arguing with OCD. I let OCD say whatever it wanted to say. If it wanted to be the center of attention, go right ahead. I don't have to argue with it or pay it attention. So hopefully that helped. All right, so I'm going to try to, I have 3 minutes, so I'm going to try to rapidly. I'm not going to get any more pre-asked questions, and the reason for that is because when Liz is back, she's so much better at that than me. I think I'm good at the live questions. She's good at the pre-submitted, so I'll have her do those. And Skyla, don't get rid of the 2 medication ones because I want to talk to Liz about that. All right, so any from Style Poo, I'm probably butchering that at 1248, says, any tips to overcome eye contact anxiety? I'm afraid to look at people in fear that my eyes will look at their insecurities parts. I need to get over this. I'm going to totally be honest and open right now because, hey, we're with the community. One of the OCDs that I had is like I hated looking at people because my brain was like, don't look at their private parts. Don't look at the private parts. I don't know if that's what your fear is or if your fear is like they have certain insecurities about their appearance and you're going to stare at that. I know that John Grayson has done a talk on like compulsive staring. Remember, what we resist persists. So the more that you resist eye contact, like I resisted eye contact, the more your brain is going to say, okay, good. Because if you would have looked at them, you would have stared at their insecurities. Phew, good job. But then you're inevitably going to have to give eye contact. And then what's going to end up happening is you're going to be like freaking out because you're like, okay, I can't look at their insecurities. And if this is your fear, looking at their insecurity parts, I don't think you mean private parts like mine, but like insecure parts, the problem that's going to happen is you don't know their insecure parts. So you're going to be looking at them in the eyes and then freaking out. Where do I look? And then you're going to feel like you have to stare them right at the eyes and not look anywhere else. But then what if their eyes are, it's a mess. And what I tell people is get off the train. It's not going anywhere good. So get off the train. So what you do is you say, I'm going to give them eye contact like I would anybody else. We typically look at this kind of triangle right here. So at their eyes and nose, I'm going to look there. That's their insecure part. Okay, there's nothing I could do. I can't look at their feet or look down, and I can't avoid people anymore. So I may be making them insecure. And look, they're adults. If they're insecure about some place I'm looking, I'll let them tell me, hey, you're looking at my eyes, I'm insecure. Is it okay if you look at my mouth or something? Probably not going to happen, but that's always an option. But your job is to no longer try to prevent or stop this from happening. That's a mistake people make. And the more that you resist it, the more that it persists. Whew. I'll take the last question because I feel better if I get all the questions. Can OCD be used as an advantage? That's Beirut. What I would argue is OCD will never make your life better. How it does help is all of you are strong, powerful individuals that wake up every day and fight this disorder. And that fight and that strength that you have by kicking OCD's butt, that strength will live on you forever. So I feel like I'm a strong, amazing human being because of the fight that I fought against OCD, and you will be too. What people will ask me is say, but hey, I study really well. I'm really good at details because of OCD. Don't give OCD the credit. You are good at details and you're good at paying attention to details and to edit things and all that because you're talented at that, because you're good at that. That's why you're good at that. It has nothing to do with OCD. You have that skill. What OCD's done is latched onto that skill and taken it to an extreme, which has now turned it to be inconvenient and made it harder to live with. So that talent that you have is your God, or I don't want to say religion because some people might not be religious, but that is your God-given, your universe-given, your science-given ability. And OCD is just accentuating it to make it too extreme. So once OCD is gone, it'll go back to being helpful. So I am really good at like organizing thoughts and getting things done. Now I can do it on my own control and it's helpful. Whereas when I had it with OCD, it was terrible. And then the strength, like I said, you don't get because of OCD, you get it because you fight OCD. Kim, you asked how you could contact me. As one of the advocates, I love talking to people all over. I would say the best way to contact any of our advocates, and so you can contact this way, is oh shoot, we talked about how to contact us and then I think I'm going to do it wrong. But why don't you do this, Kim? Why don't you email us at info@iocdf.org, and then they'll yell at me in the back if that was wrong. But if you email us at info@iocdf.org, and then just in the subject line, just ask if it could be forwarded to Chris, and then they'll forward it to me, and then we can connect. So thank you for your kind words. So that's info@iocdf.org, info@iocdf.org. And then I'll double check with how we're supposed to be doing it. Thank you all. Whew, okay, so that is so much harder. I love working with Liz because we can bounce it off. So that was fun, though. I hope everybody that came today got something from it. If I answered every question, so hopefully I answered your question. If I missed one, you can always submit the questions to iocdf.org/peace of mind, and we will get to your questions. If you submitted a pre-submitted question or disappointed I didn't get to it, I promise that we'll get to it next live stream with Liz. It's so much easier for me to do the live questions than going back and forth between tabs. It just makes me look like I'm not paying attention. So when there's two of us, it's easier. So Liz and I, we had a lot of good submitted questions. We had a lot this time, so we will definitely get to them next time. For those of you that submitted the medication-based questions, we will absolutely get to those. I'm going to talk to Liz about having a psychiatrist on, because so for you all to know the laws, like we should know something about medication to help guide our clients, but we really let psychiatrists do their thing. Just like we train as therapists, they train as psychiatrists. So we want to make sure that they are answering the questions. So I'll talk to Liz about that. I think that would be really good. To everybody saying really kind things in the comments, you guys are amazing. I hope this gave you a sense of community, answered your questions. Remember, every Wednesday at 9 a.m. Pacific Standard Time, 12 Eastern Time, there's going to be a live stream. For the first and third Wednesdays, it's always going to be Liz and myself with Ask the Experts. Every second Wednesday, it's going to be Kyle and Dr. Abramowitz, and they're going to be doing research-based roundtable where they take a piece of new cutting-edge OCD research and they make it digestible for all of us. So it's always good to know about the latest treatments on OCD. And then the final and fourth Wednesday of the month, we do a lunch and learn where we have a topic and we bring on experts. I think we have an extra Wednesday this month. So I think Liz and I will go back to questions. Or she may want to take it solo since I did it solo, so we'll let you know. But thank you for everyone who came out. Thank you for your kind words. Hopefully this was helpful. Hopefully you got something from it. Remember, you're not alone. There's treatment out there and you have an IOCF community in front of you. Make sure to go to iocdf.org for information, for upcoming events, and for concerts. Don't forget to like and subscribe so it will notify you when new streams are coming out. So whatever platform you watch us in, make sure to live and to absolutely subscribe. And lastly, if you have questions or topics you want, iocdf.org/peace of mind. I hope everybody has an amazing day. And I always want to say, as somebody that has been through OCD, doesn't mean I don't have it. We're going to have it forever. But as somebody who's been through extremely severe OCD and is now living a fulfilled life, I promise you that it is not just me. It is not just Liz. It's not just Ethan. It's not just our advocates. All of you can absolutely get better. And I believe in all of you, and I know it's going to happen. So keep sticking with us and keep fighting. Take care. Everybody have an amazing rest of your day and enjoy. Take care. Bye.